Welcome, guys, to the Cup of Nurses podcast with your hosts, Peter Findero and myself, Matt Slarchik. This is a podcast where we tackle current health news and hot nursing topics, one conversation at a time. Thank you guys for listening, tuning in. We appreciate everybody that reviews, follows, and shares our content. We appreciate that. That helps our podcast grow, and you don't believe how much it helps us when you smash the 5 stars. It gets us ranked in search results. More people discover us, and it motivates us to keep creating this high quality content. So don't forget to like, share, comment, and subscribe. We appreciate that, man. How are you doing, Pete?
I'm doing great. So guys, on this episode, we are going to talk about developing professionalism in the workplace. And we're going to touch upon social media. What is like the boundaries for a good social media profile? What can you post? What shouldn't you post? And everything in between. So as nurses, we're professionals. And a lot of our care is basically based off HIPAA regulation, HIPAA guidelines. So we have to be in a professional manner a little bit different than other people. Because if you think of other jobs, a lot of times those jobs incorporate those jobs work around majority of the time numbers, like account numbers. If you think of like finance, you think of like that kind of privacy and that aspect, like your debit card, credit card. In nursing, it's more of like a personal privacy where we deal with patients one-on-one, and anything that we say and we do that's supposed to be kept just with that patient, because some people are really health conscious, very self-conscious, and they're in a very bad spot in their life in a hospital. Nobody ever wants to be in a hospital, and they feel most vulnerable at that place. And HIPAA basically established guidelines to these vulnerable people to make them, you could say less vulnerable, because most people do not want their health information out there, and nobody wants their health information to spread, because that's their privacy, that's their information.
Yeah,
and especially in a hospital, one more thing, especially in a hospital where they're so vulnerable, they have no control over anything, we should at least give them that privacy and that sense of like quality care and that sense of safety.
And I agree with you completely. And it gets a little bit more tricky when sometimes you have those, patients that one family could know something, another one can't. Like I had a scenario where the patient was HIV positive, and one sister knew, but the other 2 sisters didn't know, because it was a whole religious thing, meaning, the guy was homosexual and they were Muslim, and it couldn't be known. And it sucks when we have these, situations in place, because the patient is dying. Why are they dying? Because they're immunocompromised, and he's in sepsis, and I can't tell the family the truth of what's happening because only one person knows the truth. So definitely information gets tricky in nursing, so there's not like the one be all end all, and HIPAA. It's interesting, but nevertheless, we have to develop professionalism in the workplace, and that's what kind of helps us guide. It's like a moral compass for us to guide us throughout all these different experiences and situations that we see as a nurse.
Yeah, I want to give a quick shout out to like social work. As night shift nurse, we never deal with social workers, right?
No.
That's a whole complete day shift thing, and I could imagine how beneficial and how valuable they are for people that work on days. And night wise, we don't get social work involved unless like a very serious or special case, because social work works on a 9-to-5 schedule for the most part. So they're gonna be there for the days. That's when the family's there. That's when they could set up meetings. And I feel like at nighttime we don't really think of social work. We just pass on to day shift. Hey, maybe we should get social work involved, and that's all. We don't really have that appreciation for social workers, but they're definitely out there, and like I completely respect them, and I love for what they do, because they do a lot of the painstaking hard work and a discussion with the family.
And I love reading their notes, because we're able to find out what the plan of care is outside of work, whether they're going to home health, long-term facility, any kind of tricky family situations, they're involved, and we're able to kind of read the note and figure it out. So yeah, shout out to social work. We love you.
Yeah. For developing a professional personality or a professional environment in a workplace, we want to touch upon 6 things. It's going to be conflict resolution, ethical thinking, adaptability, leadership, collaboration, and positive attitude. So the first main one is going to be conflict resolution. As nurses, well, probably more on days than on nights, but we do see a lot of, like Matt said, with the whole HIV patient, a lot of conflict of interest with families, like especially if someone doesn't have a direct. Dude, I'm losing my train of thought.
It's okay.
Direct. When you people come in a hospital and you ask if they want to be code status.
Okay, correct.
What is that called?
Just knowing the code
No,
says.
but there's another word for that. When people have paperwork filled out, we always ask
Oh,
about
the
admission.
pulsed, right? The pulsed.
No,
Pulse
it's not what it's
form.
called. Direct something.
Oh, advanced
Advanced
directives.
directives. Yes, I don't know why I couldn't think of that, but
Jeez, and you're a nurse, huh?
I know, right? And
It's okay.
some people don't have these advanced directives, so you don't really know how to gauge their care, because if you don't have an advanced directive and you're intubated, sedated, and you never really told anybody on what you want done for you, how do you want your care to progress, when do you want it to de-escalate, then your family's making up all these decisions for you, right? And a lot of times there's a conflict of interest because some family members want to hold on to that life forever, and some family members are understand the situation and understand that if there is going to be a quality of life, it's going to be a very poor quality of life, and they know that their family member would not want that kind of life. And that's kind of when they butt heads. The sister says, I want everything, and then the brother says, no, this is our dad, we know what we wanted, even though he never told us in person. He always hinted at he doesn't want these extreme measures done. And that's kind of where social work comes in. It's kind of where nurses come in with their conflict resolution, but it's actually really, really hard because we're dealing with someone's life. So once these measures are exacerbated, once we do everything that we can, and the plan of care is to de-escalate the aggressiveness of the care, there's really no going back to that, because once the patient passes away, there's no way we could get him back, especially if you, but I'm not saying don't do a DNR. I'm saying that DNRs are important, but once you do a DNR, I'm not saying you can't reverse it. I'm saying once you do a DNR and you put that thought in motion, and hospice care gets involved, palliative care gets involved, and everyone's doing their thing, it's really hard to kind of regress from that.
Yeah.
So if you're going full hospice, full palliative care, you could be palliative hospice for a few months, because we're all different. Hospice and palliative care isn't like a 1 week, 2 week kind of situation. The person passes away. It could last months, and it doesn't get any easier, because you see your family member there for a month. We're giving them pain medication, making them comfortable, but they're not fully passing. They're not dead yet. So like you're still grasping on, but.
Yeah.
It's really hard for nurses and for medical professionals to reverse that. So if you're already on a month of hospice, then you decide, hey, we want to be aggressive again. That's going to be really hard for us to do, and that's almost like a no turning back kind of situation, even though you technically can.
Yeah, I agree with you. And sometimes you have patients that are, DNRs for 6 months and then get reversed. Yeah. And when it comes to conflict resolution, it could be also as simple as safely communicating with the patient that's getting agitated, that's, withdrawing from alcohol, and how do you professionally manage that patient and tell them, hey, listen, Joe, we have to stay in bed, we have to kind of calm down, and you kind of go through the motions, and sometimes it'll lead, hey, we have to call security, sometimes we got to restrain them, but maintaining professionalism. And when it comes to professionalism in the workplace, like, nursing is always changing, and there's always different areas to improve. And even though you're a new grad, you're going to develop more skill as experience comes in, and you're going to be able to apply that knowledge to create your own professionalism and see what works, what doesn't. And let's just say one time, patient family way, you said something weird, or you said sorry for your loss, it came out the wrong way. Now you won't say it the same way. Now you're going to be more professional, and you're going to be able to deal with the death and dying a lot better. So with experience, don't worry, you're going to get better.
Yeah, I mean, I couldn't have said better myself. Next point I want to bring up is ethical thinking. So there's no really standard for this, because when it comes to ethics, everyone has their own ethics. There's really no right or wrong, right? You have a Jehovah's patient that comes in, he needs blood, and without this blood, he's going to die, right?
Yeah.
But he's Jehovah's Witness. They don't believe in getting blood, so unfortunately, we got to let that patient go. Maybe they can make some exceptions where maybe plasma might be okay, or platelets, things like that. But that's kind of where you hover on a borderline. Like sometimes medical professionals, especially doctors, want to push for them to get this blood, right? Because as a doctor, as a nurse, you want to have this patient survive. In a hospital, religion kind of gets almost put to the side, because it's about survival, right? Especially if somebody comes in, that coded and trying to bring him back to life. Those kind of things that aren't scientifically based or aren't proponents of like science and health and medicine, those kind of get pushed to the side, because we have to figure out pathophysiologically what to do and how to do it, right? So unfortunately, in this situation, if a Jehovah's patient comes in, he needs blood, and it's the only way he's going to survive, and doctors are pushing for blood, but he's Jehovah's Witness, it's kind of where you got to stand up for the patient. It's kind of where ethical dilemma comes in. That's kind of also conflict resolution, right? there's gonna be a conflict. There's a conflict of interest. The doctor wanted to save his life compared to the patient that wants to abide by his religious rules, and it gets really kind of difficult to do that. I did work with a Jehovah's patient before, and he did not want. So that's kind of where you got to come in with the whole conflict resolution again. He did not want blood, but when we asked him if he wanted like plasma or platelets, he was okay, and like cryo things like that. He was okay with. He just did not want to get the RBCs, and that's the way he interpreted his religion, is that he couldn't get the full blood. He could get different components of the plasma, different components of like the whatever is intervascular system, but he did not want the RBCs. So we kind of communicated with him, stay within the with the ethical guidelines, and also did a conflict resolution, and patient ended up being fine, that I can remember.
Yeah, and like those that are nurses and nursing students, this is where you learn the main principles of ethics in school when it comes to autonomy, right? So like the patient is able to make their own decisions, beneficence, justice, and non-maleficence, to do no harm. And there's so many situations I could think of when it comes to ethical thinking. And of course, you got to use your judgment, you got to use your professional standard and like moral conducts and make decisions. Like let's just say you have a patient that like, there was this one time where the OR nurses, whatever, they were kind of rushing the patient. This patient just signed the consent. And I'm like, hey, listen, did you talk to the doctor about this? She's like, no. I'm like, okay, she can't sign a consent. She has to talk to the surgeon first. So of course you want to always be an advocate for your patient in these scenarios, because it's unethical to get a procedure without a doctor explaining everything,
Correct.
So you have to just be aware of like where ethics may lie. Maybe it's in family members, maybe it's, the way the doctor's handling business. So just keep an open eye, understand what it's, the moral conducts, and kind of go from there.
Yeah. And it leads up to number 3, adaptability. So back to my story with the whole Jehovah's Witness. So that's a good example of adaptability. He did not want RBCs, so we thought about other ways that we could, give him more volume, right? So fluids were out of the picture, so we had to give him something. So that's kind of how we solved this. So that's us adapting. He can't get RBCs, so what else can we give him? And also with like adaptability, let's say your unit has like a lot of central line infections. They have a lot of colities, a lot of collapses. You got to be able to adapt to that. So maybe this is going to tie into leadership, our next one too. But there has to be ways to kind of fix this, because unfortunately, in a hospital, it's still on numbers based. We got to hit our marks. We got to hit our safety goals. We got to hit all these goals that are established by these nursing committees, right? So for like, if you have a lot of central line infections, it might be a good idea to adapt to it. So maybe you put in less central lines, or maybe you avoid the femoral sticks. You could avoid the central line in general by maybe putting in midlines, things like that. Or you could do, time to leadership is maybe have a nurse or have somebody that's like, for us, it could be like a break nurse or whatever, bring in like those caps for central lines.
Kudos caps, green ones.
Yeah, so maybe place a couple in each room, because there's been times where when I started up a new IV, a new line for like an antibiotic or just a KVO, but I didn't have any of those caps. So, it took me a few hours to get those caps, because they were in the room. Usually they are in like those nurse servers. They're there, but in this circumstance it wasn't. And, I told myself I'm going to get them, but then, I got delayed with other things. So there was no caps on that patient's line for maybe like 4 or 5 hours until I came back and realized, oh shit, I forgot the caps.
Yeah, and the way I also see adaptability is workflow, correct? So if you have issues that are bothering you in the hospital, your day-to-day job, how can we fix that, correct? So one, we can, get on committees and we could change things, whether, the baths, just like you say, preventing infections, correct? And sometimes it could be as easy as on a micro level, correct? Things to change on a unit to increase productivity and workflow, meaning the way that, let's just say, the unit is organized, where things are stored. Maybe the crash cart should be in that corner, where the glucometers should be. One thing that I'm going to be doing is adaptability, and like right now, travel nursing is I get floated for the past 2 shifts. I don't mind it, but it just sucks because you're just busting your ass off more. Why should you work harder if you don't have to? So if I get floated again, I'm just going to be like, hey, listen, I feel like I'm getting floated all the time. No one else is. I understand I'm a traveler, but we should make a sheet to see when was the last time somebody floated. So everyone, because everyone deserves a chance to float, and I don't care what they say, I'm going to still ask for it.
You know what's going to happen? They're going to tell them that, and they're going to turn towards me and be like, all right, Peter, you're going to float. I'll be like, you son of a
It is what it is,
like you
PD. I might
motherfucker,
put
dude.
you in the freaking hole too, but I'm getting floated. I'm playing musical chairs on a unit, and it's just like it's getting annoying for me. So I'm gonna adapt to the situation, and on a micro level, I'm gonna try to change something. So as a nurse, just be aware of things that affect your workflow and become adaptive to it.
Yeah, exactly, man. So the next one is gonna be leadership. Leadership doesn't necessarily mean you like upgrading positions. Not necessarily. Doesn't always have to be you going from a staff nurse to a charge nurse to assistant manager
Management.
to manager, things like that. You don't got to go up the ladder. Like Matt said, you could start with like these small things. You could start doing these committees, preventing these CAUTIEs, CLAPSIs. You could even go even on a smaller level where let's say like in huddle, they're saying, hey, patients aren't getting baths, and you want to be a proponent of baths because giving those correcting baths does prevent central line infections, right? So instead of you not caring, you could be like, hey Matt, you need help with a bath? I can help you right now. I got a few minutes. And they'll be like, okay, yeah. And then you help somebody do a bath, and that bath got done not necessarily for your patient but somebody else's. So you're kind of taking that leadership step forward and helping people with baths basically, right? And you're taking initiative because like I'm not sure if Matt does all his baths or not, right? I'm sure I guarantee you he does, but as a fact, I don't know, right? So let me step in and be like, hey Matt, you want to watch your patient? I got a few minutes. Yeah, and then they're getting these baths done.
Yeah, and that's a great sign of a leader. Like he takes the initiative and ability to maybe handle somebody else's stress. Like there is those nurses with if you're kind of like swimming or I would say drowning instead, there is a nurse that's going to come in there. Hey, what do you need done? And they'll handle it for you. That nurse is a great leader, not because she's a charge, the way that she just handles the situation. She knows how to enhance patient care to help you out because of things that are happening. And I don't want to name names on the unit, but depends what kind of charge nurse is on shift. You know how things are going to go. You have a charge nurse that's straight business, that knows how to handle things, can manage stress well, and also that gives like a sense of relief for the nurses, staff nurses that are working there. If you have a bad charge nurse, you can tell how dynamics change, or nurses get pissy and things like that. And that's why a leader is very important. And you can take little steps in doing that. Just like you said, baths. I'm trying to think of what else you could be a leader for. Maybe doing the huddle or bringing up a problem that's affecting other nurses and other nurses don't want to stand up for it, right? Like there's things that are pissing somebody off. Nurses keep complaining, but no one has said anything to management. So you are going to be the leader, and you want to help with patient care and enhance it. You're going to, say something and bring it up.
Yeah, number 5 is collaboration. As we know, as you guys nurses know, nursing is basically a giant collaboration of work, especially like in the ICU. We collaborate on turns, we collaborate on critical thinking. Like it's a non-site collaboration. Like imagine if as a nurse you were just locked in a room with 2 patients. It would be so much harder. If you don't have a good teamwork in nursing around your unit is gonna fail. It's gonna struggle because even doesn't matter how smart you are as a nurse and like the theory and any care, you're always gonna need help at some point.
Yeah.
And if you're not willing to help somebody, no one's gonna be willing to help you. That's why you gotta kind of be open. Like the best way to get to know a nurse and start to get along with them and can communicate is gonna be just helping them. Like or you asking for help. So if you need help turning, ask a nurse, hey, can you help me turn? Because then you guys start talking a little bit, and then they're more prone to ask you for help. And then next thing you know, she's drawing your blood, you're helping give her the bath, and it's like a giant, amazing collaboration. And same with like policy and procedures. If you want something changed, it's a lot easier to go in it as a group,
Yeah.
compared to just one nursing knocking on a supervisor's door or the ACM's door and saying, hey, I think we should do this instead of that. It means more to management if you say, hey, Becky, Sarah, Joe, Mike, and Andy and myself, we're thinking about changing this policy because we think this is going to work a little bit better, because you already have that strength in numbers. And that's where collaboration goes in, and that's how you should get shit done for the most part.
And sometimes it doesn't happen where, there's that burnout where nurses keep saying things to management and shit doesn't change. As a travel nurse, you're able to kind of like pick it out because you're floating. You hear the nurses talking, and sometimes you just have bad management. And also when it comes to collaboration, it's also on the unit, but it's also between the doctor and the family and the patient. And you're like the person in between. You're collaborating literally between all 3 individuals, and you better make sure there's everything is asynced up and everything is getting smooth. It doesn't always happen. Sometimes doctors don't communicate between each other. haven't seen it in this hospital. Of other hospitals, they don't communicate well. Well, you better be collaborating properly, updating the other doctors sometimes to making sure everything is flowing. That's more of like a day shift thing where we don't deal with that as much. But definitely on days, I believe you have to be a lot better of a collaborator with like everything that's handled. There's so much more. Like there's, PTOT, doctors, family, not as much now with C19, like you have dietaries coming in. Like it's freaking interesting working day shift.
Yeah, they're pretty good here, but there was one circumstance where, in a hospital, especially in ICU, you have different teams. You have infectious disease, you have ID, you have pulmonary, cardiac, then you have the tending, renals on board. And sometimes these physicians, they're all very knowledgeable, but they have different opinions on which way the care should go. And sometimes each physician wants to be heard more than the other, or they each have their own perspective, at the same level, and then the family has to decide on what to do, right? So if there's a miscommunication between like care, like if some physician says, hey, there's hope, we should still push with this aggressive treatment, and then you have other physicians saying that, hey, maybe we should back off, this isn't going to really go anywhere, and they're giving the family mixed signals, that gets complicated.
Yes,
that's also what goes with conflict resolution and collaboration. That's probably a good time to, as a night shift nurse, or even days, say that, hey, maybe we should get a family meeting going on, because what I'm reading in the notes between doctors, they're giving different opinions. And then when I talk to the family, they're kind of still on the border of everything, because one physician is saying this thing, the other physician is saying another thing, and they don't really come together and meet all and share their ideas and kind of the level of care or the way the care should be going. And that's why family meetings are important, because that way the family gets heard and each physician has a room to talk and has their own opinion on where the care and patients is progressing.
And especially with like our time now with like C19 and you like right now in California, we went back to the purple zone, so families can't go back to the hospital. Communication is important more than ever, and proper collaboration, because now we got to make sure that the family is being updated with what's happening and they're communicated, or whether they get a FaceTime with the patient and stuff. So yeah, it's freaking important, man.
And face-to-face communication is hard to begin with, and now everything's done remotely. So imagine how much knowledge and communication people are losing because everything's done remotely. Like how many times you have a one-on-one conversation with each other, and then 10 minutes later, like, oh, I forgot to mention, right?
Yep.
So now remotely, imagine how much is lost then.
Yeah.
Right? Because, you call family, you tell them a bunch of stuff, and then you're like, damn, I forgot to mention this. And you don't really want to call them back because it's like 4 or 5, or like 3 in the morning, and you're just like, they could be told this later. So that like a lot of stuff falls in between the cracks, especially if it's like wired communication or wireless instead of face to face.
Yeah, not only that, but even like between a nurse and a nurse, there's so much things that like happen that you told the nurse to do that maybe was lost. When we were working those 8-hour shifts in Oakland, where there was 3 nurses for the day, right? A lot of shit was getting missed because one nurse told, the day nurse this, and then the evening nurse didn't hear it from the day nurse. They forgot. And instead of it being a 12-hour shift with 2 nurses, there's 3 nurses. So if the other nurse won't see you if they forgot, because there's another nurse on. And that kind of like, it doesn't make you obligated to like handle shit. I feel like there was a lot of delay in care when we worked in Oakland.
Yeah, it happens.
It does happen.
But it falls right into positive attitude. So you guys want to maintain a positive attitude. Try to do it all the time. Like it's hard, but you should at least do it in a patient's room. Like, like, yeah, you're on your 3rd night in a row, you're exhausted, you're tired, and you want to go home, you had a rough couple of shifts. But still, when you enter that room, put on your poker face. Be positive, because if that patient, all he got was negative news all day, like, hey, your cancer metastasized from your liver to your lung, and this is aggressive cancer, you might have about 3 to 6 months to live once you start you on chemo.
Yeah.
Imagine hearing that shit. And then you have a nurse that comes in
a bad mood.
It's in a bad mood, not necessarily like angry or like negative, but just like sad and kind of withdrawn. Like that patient's energy, that nurse's energy is going to bring that energy of the patient even lower.
Yep.
Instead of like, hey, being happy and giving some kind of positivity in the room, even though you might not be able to cheer that patient up, just at least be positive. Don't be like, you don't have to necessarily say everything's gonna be okay. You still have 6 months. Like, we'll figure this out. You'll get through it. You don't have to be like that, because some patients don't want to hear that.
That's
shit.
false hope, man.
Yeah,
don't do any of that.
Yeah, some people don't want to hear that shit. Like, like just be there, care for him. If he cracks a joke, laugh. Like have some kind of good communication. Don't be like negative and sad and in that kind of like manner, you know?
Yeah, when I think of positivity in the workplace to maintain professionalism, I think of it in two ways. One is internal, correct? Leave, just like you said, leave your baggage at home. Don't be bringing your problems, your hardships to the hospital where there's already sick people that have plenty of problems. They don't want to hear your shit, nor do other nurses, correct? So leave your baggage at home, or I should say, leave your baggage in the front door. When you walk out of the hospital, you can go handle that back again. And then two, externally, how are you communicating with other nurses? And I hate that when I'm at work and you just sit down behind the nurse's station, or you kind of walk by and it's just like negative comments. All you hear is, little negative, oh, this is shitty, that's going bad, this, oh my God. Like, it's just 12 hours of constant complaining. Like, I hate coworkers like that because complaining doesn't bring any benefit to the situation. And like, sometimes, yeah, it sucks. I just kind of like suck it up and I'll just like say something, I'll laugh around, I'll throw a joke, I'll divert my feelings because another person doesn't want to hear that. That one time, back to the situation, I floated. I went back upstairs to get my lunch, and a nurse asked me how it is. And I'm just like, it's okay, it's not bad. Oh, really? Because usually when you float down there, it's bad. I'm just like, well, it sucks, but I ain't gonna complain about it.
It is what it is. Like,
exactly.
What, is complaining gonna, have the jab bleeding patient stop jab bleeding or stop taking a shit on you every few minutes? Like, no, it's not gonna solve it, And there's those nurses that complain to you and they want you to complain with them, right?
That's what it is, bro.
Yeah, they complain to you and they give you all this negativity because they want to hear back, like they get reinforced. But it's just like, I'm just like, like okay, yeah, like I know it sucks. I had that happen before, but like I don't. If someone complains, like I don't complain back to them. Like I'm not even gonna put that in my head. Like, yeah, it sucks turning a 300-pound patient, 3 times a shift because they shit the bed. But hey, that's one of those shifts, man. Like, it's gonna happen to you one way or another sooner or later. Guess what? You can't leave the patient in shit just because you don't feel like turning him, just because it's the 3rd or 4th time you did it. So you get it done, get it over with, move on. Like, right? Life goes on. Like, you're in a better situation than the patient is. Like, imagine if you were not necessarily 300 pounds, but imagine if you shit the bed.
Yeah, just
like,
be how grateful.
Right? You know how embarrassed you fucking be. Like I would be completely embarrassed. I'd be like, fuck, let me clean this up myself somehow, dude. I don't even hit the
keep
call
swearing. We're gonna get taken off YouTube here for this episode.
Yeah, well, the good thing we got a Patreon, right?
Yeah, exactly. We have to give that lady a shout out next episode. And we fall prey to it too, of course. Like, me and Peter aren't always positive. Of course, we're gonna kind of fall into the trap of talking shit a little bit or complaining, and then you just kind of you got to just be self-aware of it. Like, okay, like sometimes I do that at work. Like, I'm having a bad shift, and I'm just gonna catch myself. Like, all right, just take a deep breath. You're gonna get through it. You're gonna clock out at 7:30. Life's gonna be good again. You're gonna be back home and doing what you're doing.
Yeah, you know what actually helps out a lot too when I've feeling stressful and had that patient that just keeps shedding and I keep cleaning up because you're jag bleeding and it smells horrible. If they're sedated, intubated, I guess I'll just say it. You can put on some headphones, put in one AirPod and just go clean them up. It makes things a little bit lighter when you can jam out some music, or just put that thing or put your phone in your pocket. Like, sometimes when I have my intubated sedated patients, like my old hospital, and I knew let's say I knew them before they were sedated and intubated, right? Sometimes we talk about music and they tell me what genres they like and things like that. And sometimes when I get the same patients sedated intubated, I know what kind of music they like, right? So I just put the music on in my phone, put it somewhere in a corner or in my pocket if you're scared of germs on your phone, and just play that music. Like, maybe they like classical, so just play it. It makes wiping ass a little bit easier, dude.
Definitely.
A little bit lighter. For me, I prefer some rap, some hype music. I move around a little bit when I watch my patient up. I talk to them. But yeah, that makes it a little bit lighter if you guys can get away with that.
Definitely a night shift thing, I would say, where we're able to pop our headphone in and listen to some music. I don't know how management is about that during day shift. So, keep with a grain of salt with what we just said there. Yeah, this definitely works for nights.
Yeah, but low key, when I do my baths, curtains closed, doors closed. If you maintain privacy, nobody really should be walking in on you giving a bath unless they obviously would knock. If the door's closed, curtain closed, they know what you're doing, man. They see the sheets on the ground, they know you're giving a bath, and no one's gonna really interfere. But don't use 2 headphones. You only use 1.
Right, because you got to be aware of alarms.
Yeah, God forbid the alarms go off. Your patient fucking has no heart rate, and you're fucking jamming to some Gucci Mane $5 million intro and shit, and this patient's coding on you.
Yeah,
one headphone, guys.
That ain't gonna work out. One headphone, yeah.
Yeah. So next, we're gonna dive into privacy issues with nurses and social media. I'm sure you guys have heard of nurses getting fired for their social media posts. So according to the NCSBN, only allows medical information to be shared under three circumstances. So this is under law, you're only allowed to share information with these three ways. One is a patient has provided informed consent. So this is when the patient allows you to, provide their information to a family member, somebody that's over the phone, things like that. Two, in situations where it's legally required. So certain coroner cases, things like that with like potential rape allegations, child abuse, things like that. And then number three, when failure to disclose information could result in significant harm. So I can't really think of an example for that one, but maybe when an AIDS patient comes into the ER and there's people working on them, it's probably legally you have to disclose that a patient has probably HIV, right?
Yeah.
Because you're inserting lines, things like that. Everyone's got to know if you're putting a peripheral in, they got to know that he's HIV positive, right? I think that's how the law works, I believe.
So yes, that's actually a very good scenario.
Yeah.
And I feel like it's a very double whammy sword because social media and personal life is binding closer and closer. Just, because we're accepting it more and more. We're very more open on social media. We're posting a lot more. You saw those nursing TikToks and dancing and everybody else on the gram posting photos because, COVID, I'm a frontline survivor. Look at my nose and my face. It's all dented from that 95. That was huge. And like this year. So I feel like we as nurses, we came a pretty far way because we were afraid to say anything about the hospital back in the day. Maybe that's why we were the number one trusted profession because we didn't snitch on anything, man. We were just literally lights out. No one knows even what happens in the hospital. And now we're kind of, breaking ground. And there's podcasts like, a couple of nurses that were talking about this stuff openly. But of course, we got to maintain like professionalism and we can't say everything, right? So just like those three circumstances, we can't talk about, a specific patient, like a celebrity that was there. We can't talk about the actual person's name. Like, someone listening to this can't pinpoint a person with a specific location. So if there was a car accident in Austin, Texas, and it was this person, we can't say right now, hey, we took care of that patient, because then someone listening can actually look up car crash Austin, Texas, and pinpoint the actual information. So that's breaching HIPAA because now that patient's information got disclosed without their right. Yeah. So you got to be careful with what you say.
That's great, yeah. And there's 4 ways you can breach patient confidentiality. Some of these are obviously very obvious, but I'll go through it with you guys. So number 1 is videos or photos of patients, even if they cannot be identified. Number 2, photos or videos that reveal room numbers or patient records. Number 3, descriptions of patients, their medical conditions, and or treatments. That goes very close to what Matt said with the car accident. And number 4, referring to patients in a degrading or demeaning manner. I don't even know why you would refer to a patient in a degrading or demeaning manner. That's just like, if you do that, like on social media, like talk shit about your patient, like, come on, dude. Like we talk shit like between like as nurses, like on
scenarios,
yeah, like we talk shit like, I'm not saying patients, but like situation we like make fun of, like, because as nurses we have a different sense of humor. Like a lot of the shit that we deal with, yeah, like you guys gotta understand that a lot of stuff that we deal with is dark, is negative. So you have to have some kind of humor to lighten that up, right? Because we do deal with a lot of death, dying, lots of poor cases, lots of people that are in poor situations, a lot of disease going on. It's usually, if you're in a hospital, you have a lot of bad news, right? Nobody ever wants to be in a hospital. And we have to, unfortunately, the best way to get out of it is kind of make jokes. Not about patients or anything, but about situations, about like random things that we do by accident.
We got to lighten the air.
We have to, yeah. So I don't know why people would be talking shit about their patient online.
Yeah.
Like,
so it's like us, right? We talk about scenarios, right? But we never say, damn, dude, John Doe was a piece of this. Like, I hated him, Like, we're not degrading the patient. It's, we're accepting why they came there. They had a GI bleed. The cleaning of the poop is shitty, and we could talk shit about that, correct? Yeah. But we're not going to talk about John Doe like this is all his fault. My shift sucked because of him. It's never like that. And that's where the separator is, right?
Yeah, or something like, patient had high potassium, patient got lactulose, or high ammonia, my patient got this, like, you make fun of that because like you already know what's gonna happen. Like, there's gonna be a lot of shit involved. You're not making fun of the patient, you're making fun of the circumstance that kind of you're in. You're kind of almost making fun of yourself. Like, like we know what's gonna happen, and we don't blame the patient for having high ammonia or high potassium. Now they give them medications to make them poop it out, and things like that. It's not that we're making fun of them. It's making fun of the circumstances that we got put in.
Yeah.
You know, because we know what we have to do. We know what's going to happen, and we just do it. We're just like, it's just like us making fun of ourselves, basically.
Yeah, and that goes into like, what not to do with your social media account to maintain professionalism. It's that one that we just talked about. Don't complain about like your patients in a way. Like just maintain that professionalism where you're not degrading the patient and you're not complaining about work.
Exactly.
I feel like, we do complain about work in a way when we're doing it nonchalant with like memes.
Yeah.
I like posting memes about like, people understand nurses and nursing memes. It's dark humor. People understand it. And I'm laughing about that.
Yeah.
Like you're not going to get in trouble for posting stuff like that.
Yeah, and don't post any kind of pictures that refer to your patient. Don't post like an EKG strip with a patient's name on it and room number. Like, dude, are you kidding me? At least have like common sense to like cross it out or something. Or if you're gonna do a TikTok, don't do it in front of a patient's room where you can see the patient's face or the patient sticking out. Or don't take a picture of a procedure going on or things like that. That should be like common sense. But
Yes.
But sometimes nurses and people want the attention on social media, so it's like, yeah, I'm gonna videotape this line insertion because it's gonna look so cool on my social media. Everyone's gonna take a look at it. I'm gonna have 1,000 views. It's gonna get shared everywhere. Yeah, it probably is. I'm gonna enjoy watching it, but then I'm also gonna see you get fired from your job, which for me very beneficial. I get to see a line insertion and a femoral. You fucking see the dick and balls and everything, with the emergent femoral. Like, yeah, that's cool to see. But like, is that something that you want to put out there to, not degrade, but destroy your whole nursing future?
Yeah.
Like, no, like keep that in the hospital. Like, why would you even think of doing that? Like, but we do see like on Instagram, some people post like, different procedures. Like Dr. Miami posts his, like the breast, what is it called?
Yes, he does a lot of plastic surgeries.
Breast augmentation, things like that. It's cool. It's his, but in his circumstance, he's not doing it without the patient's consent. Like these patients know that they're gonna get filmed.
Yes.
They know it's not like you filming it without anybody knowing. It's completely a giant HIPAA violation. And if you do that, I hope you get fired because that's completely inappropriate.
So I wonder if a patient gives you consent to take a selfie, can you take a patient with a selfie? Like, I wonder how that works.
There's the hospital won't let you do it. The hospital does not allow you to create your own consent. You can't have a patient sign a non-disclaimer form by a couple nurses, dude.
No, I know that, but like, let's just say like it's just someone that like, hey, let's just take a picture. And if you post that photo up, are you going to get in trouble as a nurse?
Oh yeah, for the hospital for sure. Really? Even if you know the patient, even if the patient says okay.
Damn.
Yeah, because I guarantee you, there's gonna be some sketchy ass patient. They're gonna say yeah, and then they get a lawyer involved, and they could probably sue your ass. There's probably people out there that are willing to do that, but no, you literally get in trouble for the hospital. You can't take anything.
But
that.
Vice versa, the patient could take a photo with you because I had that done before.
Technically, they can't.
Really?
Technically, they can't.
Well, let's cut this part out.
You just probably agreed to it. That's all that happened.
Yeah, it was like really quick. It was like something with like a photo for something. I'm like, sure, sweet, here, thumbs up, smile. That's it. Kept doing my work. Yeah.
I've had patients ask me to take a picture of like their wound on like their leg or their chest or things like that. But I take it off their phone, and I give it back to them. But nothing like I never had. Like I've had in my nursing, like the nursing that I used to work in, I've had like people ask if they could videotape me, and I always say no. Like even though it wasn't related to like patient care or anything, or like even when sometimes like they family member throws a party for like the patient and they ask if you could be in a picture. A lot of times I say no to but that's just my preference because I don't know if it's gonna come back on me or not. God forbid
Life comes back full circle.
God forbid someone happens to the patient and the family member is complaining, is getting lawyers involved and doesn't remember what nurse did it, but she has a picture of you. And maybe just because maybe you had that picture, maybe you had a good relationship with the patient family member, and now it turns sour because now the family member's upset. They're not liking the care, not necessarily because of you, but like they don't like the other nurses or whatever, and they want to get social work involved and a lawyer, and their personality flips. Now instead of being with you, they're against you, and they're like they have a picture of you as a nurse, and taken by their photo, like oh he probably done it. Like I don't want to be in that situation where I know it's kind of like out of the box thinking, but still I don't want to be put in that kind of situation.
No, I agree with you, man.
Because if they don't know who to blame and they don't have any evidence, they're gonna try to use any evidence that they have. And that picture of me and their grandma is evidence of something, even though it might not be anything. It's still gonna be used for something.
You're still gonna get pinpointed. Yeah, you just gotta be careful with what you post. Like if I was, like just take a look at it, like our social media, correct? On Instagram, couple nurses, we tried to educate, we tried to provide value, we're trying to positively influence, whether it's somebody that's learning about nursing, whether it's a nursing student or a nurse. So just provide value with your content, with what you're trying to share. Nothing, everything, if it's positive, more than likely it's not going to have a bad impact. It's not going to come and get you. But once you start posting offensive stuff, language, commenting negatively, somewhere down the line, you might just get tripped up, whether it's by your, I feel like the universe always comes back in karma.
Oh yeah, I can tell you that one for sure, dude. Got a fucking 15 inches of bowel missing.
Yeah.
Karma came right back around, huh?
It did.
Shout out to Waka Flocka. But there is like a right, like Matt, there's a right way to use social media for like your benefit. Like you're a nurse. You have this special knowledge. You're literally a well of knowledge for like science, health, wellness, because this is literally what you do. You know a bunch of these species process. You know a lot about a lot of medical things, right? So what do you probably see most commonly on a nurse's social media? Like if you think a nurse trying to promote her page, what are they usually doing in that?
Well, taking pictures in scrubs, right?
In scrub, but think about minus nursing. If they're trying to expand to a different hobby,
Okay.
what do you normally see nurses doing? If you can't remember, if you can't figure it out, I'm gonna tell you. You're gonna be like, no shit.
Go.
Fitness.
No
How
shit.
many?
Let me say the word. No shit.
Yeah. How many nurses are they're nurses, and they're conscious about their health, and they're kind of like they're a nurse, and secondly they're like a gym addict, and they work out and they promote fitness, weight loss, things like that.
Sounds like the both of us.
Dude, exactly. That's just because that's what we're wired to be. Like we're really conscious on like this health level because all we literally do is health, and we're so conscious of it, and it's so engraved in our brain that we see our patients, and even though you might not think about it, we do not want to be in our position.
Yeah.
We know we don't, and that gets literally subconsciously engraved in us, and we know that one cookie might not destroy our lives and give us diabetes, but if I continue having this cookie consistently, I'm gonna get diabetes, right? And that's engraved in us. You don't gotta think about it. That thought already comes up.
Yeah, but not everybody has the willpower and the self-discipline to not continue to doing that. Because you have those nurses as well. Our example, we're just both very health conscious. Hell yeah.
Yeah, and I feel like if you're a nurse and you do want to do social media, you should definitely take it in a way where you could share that knowledge with other people, because you have a very different foundation than society. And if you could figure out a way to kind of bring that on your social media and, not necessarily start a business, but start like promoting those things. Like if you have an interest in nutrition, you could promote nutrition because you have that nursing background. It might not be a nutritionist background, but you have some kind of background in nutrition because you did take nutrition in school, and you probably know more about nutrition than a typical patient or a typical person in society.
Now, I'm honestly grateful for being a nurse. Like I've learned so much. Like one thing, and if you look at these 6 skills that we talked about for professionalism, basically communication is the bottom line. That's the golden nugget. You have to be a good communicator in nursing because you are communicating with the patient, you are communicating with the nurse, the doctor. Everything is collaborative, and if your communication sucks, you're gonna have a hard time at work. And that's what like nursing outside of like the profession, it created me to be a great communicator. It made me health conscious. Like I can handle stress, I can handle multitasking, I could be more detail oriented. So honestly, even though nursing is rough and it sucks sometimes and we, bitch and moan and complain about it, like honestly, it created me to be a very resilient individual because of nursing.
Yeah, like being a nurse is like a giant wake-up call. It's like a giant slap in the face. Like if you think of stress, like the amount of stress that I could go and deal with in a hospital, and I look at my stress here at home, it's just like a whole different fucking level, dude. Like some people say, yeah, why are you always so relaxed? Why am I always so relaxed? Because the shit I see in a hospital stresses me the fuck out, and there's nothing that compares to that stress.
Yeah.
Like, you got an assignment to do. We got to record a podcast. We have so much stuff to do with the website. We got to do this. We got to go shopping. We got to do that. This is going on at home. And then you go to hospital, and the amount of stress you get with like a patient that's crashing is not relatable to any kind of stress outside that environment.
It's a huge responsibility being accountable for somebody's life.
Yeah. It's fucking huge.
And it's for 12 hours. And the reason why they're in the ICU specifically for what we're doing, our line of work, is they're in bad shape. They're there because they're unstable. Something might happen any minute, and it's just handed on to us. And yeah, this is why there's burnout. This is why you need to have that work-life balance, just like we always talk about. And you got to find your hobbies and your purpose, because you need a creative outlet outside of nursing, because if you can't manage stress well as a nurse, it's going to eat you alive. It really will. You're not going to be able to sleep. You're going to start taking melatonin, maybe some Benadryl. Like you're gonna,
NyQuil PM.
yeah, you're maybe your boyfriend or girlfriend is going to be like, what's wrong? And you're just like emotionally drained and lack of energy because you can't handle anything because you've just been, all your energy got sucked into this medical field. And it's a freaking great and rewarding profession, but you have to learn how to unplug and you got to find balance because you got to take care of yourself first as a nurse.
Yeah. I like that you brought up communication before too, because like before nursing, I was pretty shy, pretty timid. I mean, I'm pretty timid in general now, but not as much as I was before, because like when there's shit going down and a patient's crashing and you got to deal with family, you can't just back away and not speak and not tell anybody about it. Like nursing, if you're a shy person, nursing is gonna throw you straight in the front line, and you're gonna be talking to physicians, families, like clockwork, because you have to.
Yeah.
You know, it's not like, oh, maybe, you know, I could just not bring anything up and it'll go away. No, it's not how it works, dude. You don't talk, you don't say what you fucked up on.
You
The patient
can't sweep
dies.
it underneath the rug.
Yeah, you can't delay shit. Even like little things like labs, you have to be right there, and you gotta talk. And that's just, it was scary in the beginning, you know, but you know that nursing basically broke that shell right away, because like what, patients crashing, I need some patients, let's say he's going pulmonary edema, you know, he's fucking pink frothy sputum, I need Lasix. When am I gonna run and get the Lasix? No, you gotta be like, hey, can somebody give me Lasix? This guy's, you know, is going into pulmonary edema. You need to take out his fluid basically. So instead of you rushing by yourself and getting this, you're staying with the patient unless is getting Lasix for you, and just things like that where you speed up care.
You have to.
You have to kind of do that kind of shit.
I think nursing made me more straightforward, where I'm very like blunt. I'll tell you how it is, and I don't like holding back, and it feels good because I feel like when I was younger, I felt like I was more passive aggressive. I learned how to deal with it and not tell somebody how I feel, but I didn't like the outcome. And now I just tell you how it is. I'll tell you exactly how I feel, and that's what nursing taught me, I feel like, in these 4 years.
Yeah, pretty cool, right?
It is
When you
freaking
look
dope.
back at it.
Yeah, and it's you know, it seems like it's a lot of people just have a job and they're just going to it and they're not learning anything from it. Like one cool thing about nursing, and that's what as much as I love it, I hate it. And like, dude, every single day you're learning. Like your knowledge is constantly adapting. Your experience, like if Peter tells you he did one situation different a year ago, like maybe his outcome is completely different now, and he's handling the situation better because just years of experience. You just keep getting crafted into it, and I just want to say it for all the new grads listening or anybody that wants to be a nurse. Like, yeah, you're gonna feel like you don't know shit. You're about to take your NCLEX. You're not gonna feel like you don't know shit. You're gonna finish orientation. You're gonna feel like, whoa, why am I here? Like, it's okay. It just takes some time because this is not your regular career.
Yeah. It took you 4 years to learn the basics of nursing theory. It's gonna take you another 4 to build up that confidence as a nurse.
Yeah.
It's crazy because nursing school, it's all theory, and nursing is literally all hands-on, and it's a tough career. I definitely when I went to nursing, I did not expect it to be like this, but you know, hey, we learn and we're constantly learning. That's what's kind of cool about nursing, is like you're constantly learning about something, right? If compared to being like an accountant or somebody that works like for the most like trades, like you kind of have one way to do something.
Automated.
You have one way to do something, and you just keep doing it over and over again. And this is like different. Like same disease, different patient, probably gonna treat it a little bit differently than the other one.
Yeah, it's a love-hate there because sometimes I wish I could just come into work and I already know like what's up and this is, this is how it's going to go down, protocol. But nah, like every day you go to work and you don't know what patients will have, what to expect, what's going to happen. That's just the beauty of nursing in a way.
Yeah, it's cool. All right, guys, thank you for tuning in. We went over 6 ways to develop professionalism in the workplace. We also touched up on how to use social media properly without violating HIPAA and getting yourself in trouble. And thank you for tuning in. See you guys next Friday. All right.
Peace.
Peace out.